All right, well, welcome back to the second half of the videos on neoplasia and cancer. And we're starting out talking about pre-malignant states and conditions. So we talked before about neoplasms and that they evolve from normal tissues. And dysplasia can occur first, but dysplasia is a pre-malignant state. So the tissues don't exactly look normal, but they're not yet malignant. Now, the other thing is that dysplastic cells don't have to become malignant, and they can regress and become normal again. Then you have carcinoma in situ, and this is where the cancer never goes beyond the basement membrane or never metastasizes into the lymphatic system and the bloodstream. So here's a picture of in situ where this is the basement membrane and the cells stay above it, whereas invasion can occur where the basement membrane breaks down, and then you either have spread through the lymphatic system or spread through the bloodstream. And then you can have it in what's called arrest extravasation, and that's where it stops in the blood itself and becomes cancerous there. Or you might have these little micro metastases, or you may have colonization, and then we'll talk about angiogenesis or bringing in blood vessels to feed the cancer. All right, so in this slide, you can see normal squamous, stratified squamous cells of the epithelial layer of the skin here, and then these cells are malignant. But this is carcinoma in situ because you can see how the basement membrane has not broken down here on either side. These are cells of the esophagus, and this is normal stratified squamous. But here we have columnar cells, and these columnar cells also have goblet cells in them, and this is what we would call Barrett's esophagus. And these are dysplastic cells. They have not yet become malignant cells. So these are cells of the cervix. The normal cells are here on the left side, and then these cells on the right side are cells that are becoming malignant. You have normal cells here on the left side, and then you have malignant cells on the right side. And one of the things that you can see is that the nuclei look very different. They're usually thicker, you might say, and larger than what normal nuclei should look like. So these cells are squamous cells, and they were scraped from the uterus, probably from a pap smear. And you can see the dysplastic cells here going into malignant cells, and they're much smaller in size. And the nucleus, you can see the difference between normal and these nuclei here, which are your pycnotic nuclei. Now, the spread of neoplasms, you can have what's called direct invasion and extension. You can have seeding of cancer cells in the cavities of the body, and then you can have metastases. So talk about invasion first. So cancer is actually the Latin term for crab-like, and what happens with these invasions is that you get these little projections of the cancerous cells moving throughout the tissue. Now, these cancer cells then can secrete kind of like digestive enzymes, and it breaks down any protein barriers so that the cancer cells can continue to project into the tissues. And so it makes it very difficult to remove any of these cells by surgical procedures, because you may have these really thin lines of cells that are penetrating into different places. Seeding is going to occur in body cavities. So what happens is you have little pieces of the cells of the tumor that shed off, and then they are able to float, and then what happens is they land on a surface of the body, and then they start to take root, and once they do, they can secrete a lot of fluid. So you may see like ascites, which is a lot of fluid building up in the abdominal cavity, or pleural effusion, which is fluid in the lungs. So you can see at the arrow, you have the seeding that's occurred right here in the small intestine. So with metastases, the cancer is able to move from one place to another, and it's typically going to use the lymphatic system or the bloodstream. So for instance, breast cancer can move from the lymphatic system into lymph nodes, or it could get into the bloodstream and then move into the bone. That happens a lot with like uterine cancer, gets into the bloodstream, moves to the brain. And it's very interesting because a lot of these cancers will move from one area to the body to another very specific area of the body. And then of course metastases could also occur by the seeding as well. So you can see that these cancer cells, they're going to break down the barrier even of the bloodstream and then be able to migrate into the bloodstream and then move through that bloodstream to an area someplace else in the body and invade that area and take root and grow. So this is metastases here. Got another one here, and then you can see microscopically you've got these metastases going on, and then these are all metastases here that are growing, and then this is the large one right here. Angiogenesis is where the cancer cells, the neoplasm, is able to cause the blood vessels to increase in that area. So for instance, it's releasing certain chemicals that are actually causing the blood vessels to grow and then to grow up into the tumor cells so that these very rapidly producing cells can be fed. This is liver metastases. And again, keep in mind that these cells, they're not well differentiated, so they're not able to do the job of the hepatocytes. This is normal cervical cells. And then these are cervical cells that have metastasized. Now, let's go back to this picture. You can see the darker purple here. This is the basement membrane. And you can see that very distinctly. There's no basement membrane here. So that's the other thing that can happen is the basement membrane can break down and then these cells can move throughout. Another way that the dysplasia and the neoplasm can occur in the cervix is from human papillomavirus. So this virus causes dysplasia, and then eventually that leads into carcinoma in situ. And then eventually the basement membrane is broken down like we just saw, and you get invasive carcinoma. This could take years, and it really is sped up if you have repeated infections of this virus. And then this is a picture of the mouth of the cervix here, and then here is the cancer, the neoplasm. Now, when we're looking at malignancies, there's what's called grading and staging. Now, staging is probably a little bit more accurate than grading, but grading helps you to look at the cell and to assess the degree of differentiation of that cell. Cancer staging is an evaluation of the behavior of the tumor and its spread. So you're looking at this by physical exam, history of the patient, diagnostic imaging, and so on. And it's a little bit more in-depth and thorough than grading. However, grading is going to be 1, 2, 3, and 4. Normal cells are well-differentiated cells, so they have a grade 1. But as these cells start to change, they don't quite look like themselves. They're not really doing the job they're supposed to be doing, but they're not typically cancerous cells. So this is a grade 2 dysplastic cell. Grade 3, it's very poorly differentiated. Grade 4 is where we're worried. This is nearly what we would call anaplastic, which we'll talk about. And the cells have become very less differentiated. And this shows you the same thing. You're looking at normal cells here, and of course they're changing structure, and eventually they don't look anything like themselves as they go through that grading. And this is actually a final tumor cell, so that's grade 5. And again, normal until the cells begin to totally fall apart and become cancerous. So staging is TNM classification, and T tells you the extent of invasion of this metastasis. N is telling you if lymph nodes are involved, and M tells you whether it has metastasized and how far. So if we look at this picture of the lungs, you have T1, T2, T3, T4, and this is a 1 because there's not, and remember T1 is extensive invasion. There's not a lot of invasion, whereas T4, much more invasion compared to 2 and 3. N is the lymph nodes that are involved, and so you can grade these, okay, give them the stage of N1, N2, N3, and then if you have a metastases here. So you can be a little bit more specific with the T's. N0 would be no lymph node involvement, whereas N3 more distant lymph nodes. M0 no metastases, M1 distant metastases present, and so on. And then you can see here's T1, and then T2, it's broken through the basement membrane, and then you can see T3 and T4, and we're getting close to a blood vessel here, and it here has metastasized into a lymph node, nothing here, and once it gets into this blood vessel, or excuse me, it will be able to metastasize into further regions. So again, benign, these are tumors that do not penetrate or invade into adjacent tissues. They're not metastasizing to different sites, whereas a malignant tumor, it invades surrounding tissues and does metastasize. And it can take up residence and it grows, and then of course it can invade again. So benign versus malignant tumors can kill. Benign tumors mostly don't kill. However, we did talk about it depends on those tumors because they can get very large and they can press on different areas, like a meningioma. This is a tumor in the meninges, and it can actually cause pressure on the brain. A myxoma is a tumor in the atrium, and that can block, for instance, orifices or block actually the mitral valve. Benign tumors in general resemble their parent tissue. The lining epithelium may resemble that of normal tissue, and so again, the thing about benign tumors is they're surrounded by a connective tissue capsule which doesn't allow them to metastasize. So this is a benign lipoma, and so basically what this is a fatty tumor. And one of the things you can do with this tumor is it has like a little stem. So to know that it's a lipoma, you can get your fingers all the way around this. And like there are dogs, for instance, who will get like fatty lipomas underneath the skin. And you'll know that it's a lipoma because you can get your fingers all the way around and kind of pull it up. And these, of course, are not dangerous. They're not going to spread. This is a leiomyomas of the uterus, and these are also benign. However, you can see that this uterus had been removed, and so these can cause pain and bleeding and then difficulties for the patient. These are adenomas of the colon. And remember, adenomas are glandular tissue, and sometimes these are referred to as polyps. So you can see like the little stem here. And so it creates polyps of the colon. This is a schwannoma. This is actually a benign tumor of a Schwann cell. Kind of an interesting thing to look at. This is a hepatic adenoma. You can see that right there. Normal cartilage and benign cartilage. So you can see the difference in the cells and in the connective tissue, or I should say cartilaginous tissue. And so we call this a benign chondroma. normal thyroid tissue and a benign thyroid adenoma. And this is the capsule, and then these are the follicles in the thyroid that are the adenomas. This is a lung hematoma. You can see it right here, but then they've blown it up so you can see it better. Malignant tumors are usually going to carry the same name, except that they have the suffix of a carcinoma, and that is applied to epithelial cancers, and a sarcoma, which is applied to mesenchymal cancers. So a gastric adenocarcinoma, and this is a malignant tumor of the stomach. And of course, those are your glands. And then squamous cell carcinoma, this is an invasive tumor of the skin. Transitional cell carcinoma, this is a malignant tumor of the bladder. So again, usually carries the name of whatever it may be. The tumor carries that name with carcinoma as the suffix with epithelial cancers, and then sarcoma with mesenchymal cancers. So malignant neoplasms, they grow rapidly, they can invade, infiltrate, spread widely, they lack a defined capsule, and the margins are not clearly separated from normal tissue, hard to remove this, and have the potential to kill regardless of their original location. They tend to compress blood vessels, and they can cause ischemia and tissue necrosis because what they do is they invade into that tissue and there may not be enough blood supply now. And they rob normal tissue of their essential nutrients. Those tissues are not doing what they're supposed to do anymore, so instead they're secreting various different hormones, toxins, enzymes, things that can destroy the normal tissue. So malignant tumor cells have a different structure than the parent tissue, okay? And they take on a different function. And now we can have anaplasia, strange mitotic activity, invasion, and metastases. So anaplasia is a change of cells to a more poorly differentiated version, and it's the hallmark of a malignant neoplasm. And the loss of that differentiation, and they lose orientation to one another, which is why they're able to spread. And the degree of anaplasia correlates with the aggressiveness of the tumor. So with anaplasia, you may have pleomorphism, which is a variation in the size and shape of the cells. Also the nuclei, they become hyperchromatic, which means the chromatin clumps up and becomes much darker, more prominent, and then that atypical mitoses, and you have these bizarre looking cells take on weird shapes. So this would be a well differentiated cell, and as you go down, your cells become less and less differentiated, even going into the bloodstream and various glands. You can see here you actually have multiple nuclei inside of this nucleus, which is very unusual. And these nuclei are much more dense, okay? And they look odd. These are white blood cells, and those nuclei don't look normal. Mitotic activity, you have an abundance of mitosis going on, and that mitosis is strange. So you can see all the DNA here in going through mitosis. That's not what it's supposed to look like at all. Invasion, we talked about that, being able to get into blood vessels and into lymphatic vessels. This is normal keratin. And then you can see the keratin is starting to break through the basement membrane. And there's a really nice up-close picture of all of those cells being able to break through. Another good picture of invasion here. And notice all these little dark dots here. Those are actually macrophage trying to fight off this invasion. So this is just showing you the cell going through the basement membrane and continuing to grow until eventually it can metastasize through the bloodstream to a different location. This is a hepatocellular carcinoma, and you can see that here, and then you can see how it has invaded all throughout here and metastasized. That is not an actual capsule here. That's just part of the liver. This is a renal cell carcinoma, and you can see all of these tumors here, and then all of this invasion that's going on. Malignant melanoma. So it started out really small, and you can see it had a distinct border at first, and then it began to spread and metastasize, and the border became very unusual. Squamous cell carcinoma of the lungs, and it starts to metastasize into little tiny bronchioles, and over time it starts to break things down, including blood vessels, and your patient may end up having hemoptysis, which is they're coughing up blood, and then they're in a lot of pain. The interesting thing about this kind of lung cancer is that it's usually asymptomatic until it has metastasized quite far. And then a lot of times it's too late for the patient. Ductal cell carcinoma of the breast, and you can see all of this kind of gritty carcinoma as it moves through all the ducts of the breast. This is adenocarcinoma of the colon, and you can see it's broken down the walls of the colon. This is also adenocell carcinoma, on here, here. And then this is normal tissue of the cervix, and then you can see this is the neoplasm that's occurred and is broken right through the basement membrane. Squamous cell carcinoma. That cannot feel good. Same thing, squamous cell carcinoma. And this is looking at it microscopically, so you can see how unusual the cell structure becomes. This is an osteosarcoma, and so this is the tumor here, but it has also penetrated into the bone itself and into the bone marrow. Makes the bone very soft. Hepatocellular carcinoma. And then this is just a chart showing you the difference between malignant and benign, and we've gone over all of this, but you can look at that later if you'd like. Cancer treatments. So we have a couple different types, and one is radiation. This can be used as the primary source, or it can also just be what we call an adjuvant or an add-on kind of treatment with surgery and chemotherapy. And what what radiation is doing to these cancer cells is we're using these high energy particles or high energy waves, and it's going to destroy the cells that are going through rapid mitosis. So absorption of this energy from the radiation is hopefully localized into certain cells, and it can kill those cells, it halts proliferation, and it causes a lot of times damage to the DNA of the cell, and the DNA is so damaged that the cell isn't able to replicate. Now, unfortunately, radiation can injure healthy cells too. So we can do what's called external beam or teletherapy radiation, where there's a beam at a distance that's aimed at the tumor. Brachytherapy is a sealed radioactive source is placed close or directly on the site of the tumor, and then the systemic radiation is actually where you're going to either drink the radiation or it's injected directly into the tumor itself. Chemotherapy. This is treatment that enables drugs to reach the tumor, and one of the things those drugs are going to do is damage the DNA, and it blocks cellular division, and hopefully the cell dies. And again, these chemicals, these drugs are targeting cells that go through rapid mitosis, so which is one of the reasons why people have alopecia or hair loss with them. Indirect DNA interacting is where the chemical is interrupting certain biochemical pathways so that DNA cannot be produced during the replication process. And then one of the problems is that these chemotherapies, just like the radiation therapy, can also be toxic to the medical professional. So when you're handling this stuff, you need to be really careful, because if you're not careful, that therapy can be acting on you. So another type of cancer treatment is hormonal therapy, and this is where these drugs are designed to disrupt the hormonal environment of the cancer cells. So these cancer cells are responsive to certain hormones from our body that are going to help them to grow, or they even can produce certain hormones to help with their growth. So we're going to disrupt that and not allow that to happen. Then there's also immunotherapy, where we make monoclonal antibodies, and these are antibodies that can directly bind to the cancer cells, and then it makes it easier for phagocytes by opsonization to grab a hold of those antibodies and to eat up those cancer cells. There are also biological response, where we can give them interferon that stimulates the immune system, especially natural killer cells and cytotoxic T cells, to hope to break up those cancer cells. And then there are other types of therapies where we can block specific enzymes and growth factors to stop the cancer cells from multiplying. There are some surgeries that can help, like cryosurgeries, chemosurgery, laser surgery, laparoscopic surgery. The cryosurgery, a lot of times this is used for cervical cancer, and they're going to put liquid nitrogen up into the cervix, and then they're going to scrape all of those cells out. Chemosurgery, they're using like a paste that they can also freeze the cells and then remove the tumor. And then laser surgery, of course, they're using a laser beam. Laparoscopic surgery, where they're going in through small incisions to be able to cut that cancer out. And then there is stem cell transplantation. So this happens especially with leukemia, and what they're doing is they're going to irradiate or kill off the person's bone marrow, and then they're going to transplant stem cells into that area and hope that those stem cells grow back, and they grow back non-cancerous. So clinical manifestations of cancer, one of the problems is tissue integrity, and again, you could have blood vessels that erode because the cancer is compressing that area. You get necrosis, ulceration, hemorrhaging, and then there's cancer cachexia, where the person loses weight and they lose body fat, muscle tissue, they're very weak, they don't want to eat, they can become anemic from this. And then you have what's called perineoplastic syndrome, where the tumor is releasing hormones that can mimic other areas of the body. And it can also control growth of our hematopoietic system and growth of the skin, growth of neurological tissue. And this is not directly at the site of the cancer. So for instance, cancer may cause Cushing's syndrome because the cancer itself is actually producing the hormone ACTH. And ACTH can stimulate the adrenal glands to make calcium, or excuse me, not calcium, to make cortisol, and now you have excess cortisol and you've developed Cushing's syndrome. Or you might have something called Lambert-Eaton syndrome, and this is very similar to myasthenia gravis, where muscles are not able to work. So perineoplastic syndrome can be a really bad side effect to cancer. And there are a bunch of other reasons that cancer can occur in a person, and it can be heredity, hormones, different chemicals you've been exposed to, radiation, and then of course ways to treat that would be stem cells and different types of therapies.